Welcome to our bi-weekly series. I'm Jack, and with me is Jillian. We're diving into the latest on U.S. vaccine policy, and it's been a wild ride. Summer is nearly here, and the rhythm of vaccine policy is shifting with the season. Most state legislative sessions have wrapped up or are about to, so the flood of bills we've been tracking is slowing to a trickle. That doesn't mean things are quiet, though. Federal leadership keeps reshuffling. The Advisory Committee on Immunization Practices Charter is back, and the global picture is anything but calm. Listen to this. The Department of Health and Human Services published a revised ACIP charter that rewrote eligibility requirements, added vaccine-skeptical liaison organizations, and expanded the committee's scope of revisiting existing vaccine recommendations.
What's your take on this?
The new charter removed some of the controversial language from the April iteration. It no longer explicitly calls out mRNA vaccines as a focus for vaccine safety reviews. The flexibility piece is significant. As law professor Dorit Reiss notes, the new language acknowledges the court's injunction and that previous ACIP members likely wouldn't have met the requirements anyway. However, the new language also remains vague enough that it doesn't explicitly prevent Kennedy from trying again with new appointments. Under the newest charter language, Kennedy retains ultimate authority over ACIP membership, and there is no language specifying how often the committee should convene. I've got to say, I'm skeptical about the whole thing. It smells like more government gain. The June 24th to 26 ACIP meeting is still listed on the Centers for Disease Control and Prevention website despite the stay, which prohibits the committee from taking action. We're keeping a close eye on this to see whether the meeting will still happen, and if it does, what it would and could look like. More personnel shakeups are happening. Dr. Catherine Sarama served less than 3 weeks as the acting director of the Center for Biologics Evaluation and Research. She had stepped into the role on May 1st, following Vinay Prasad's March departure. Kareem Mikhail, a former pharmaceutical executive who joined the FDA in 2025 as a senior advisor, will now take that role. Dr. Tracy Beth Haig is out as acting director of the Center for Drug Evaluation and Research. She says she was fired on May 15th after refusing to resign. Her departure came just days after FDA Commissioner Marty Makary resigned as part of a broader leadership shakeup at the agency. Dr. Michael Davis, CDER's previous deputy director, will now serve as acting director in her stead. Acting head of the National Institute of Health's National Institute of Allergy and Infectious Diseases, Dr. Jeffrey Taubenberger, has stepped down after serving in the role since April 2025. The exact timing of or reasoning for his departure remains unclear. While Nicole Safier awaits Senate confirmation to become the next U.S. Surgeon General, HHS has appointed Stephanie Haradopoulos as the interim Surgeon General. Despite the wave of Make America Healthy Again-backed legislation, this legislative session aimed at weakening school vaccine requirements. Most of those bills failed to become law. Lobbying efforts from groups like the American Academy of Pediatrics and American Families for Vaccines helped reverse the course of several of these bills. Legislative sessions in Alaska, Arizona, Illinois, Louisiana, Minnesota, Missouri, Oklahoma, and South Carolina have all ended since our last issue. On May 19th, Iowa Governor Kim Reynolds signed SF 304, which will limit teenagers from receiving the human papillomavirus or hepatitis B vaccines without parental permission. The law will take effect on July 1st. In Illinois, SB 3487 would amend the Hospital Licensing Act and require hospitals to identify and offer eligible patients influenza and pneumococcal vaccines in accordance with ACIP and the state public health director. The bill passed the House last week, but is still awaiting the governor's signature. West Virginia remains one of only a handful of states without a religious exemption for school vaccination, and that's being challenged in court. For full details on the briefs filed by the families and the governor, we'll keep an eye on this. The school board's reply brief is due on June 1st. The Solicitor General weighed in on a case about New York healthcare workers who were fired for refusing the COVID-19 vaccine on religious grounds. The Department of Justice argued that the Supreme Court shouldn't take the case, a move that drew sharp criticism from supporters of the Trump administration. After early success in animal models, scientists in Chile were close to moving a vaccine for the Andes hantavirus to human testing, but they ran out of money. This week, Gavi provided HHS with a formal timeline to phase out thimerosal-containing vaccines. It's important to note that this transition was already in the works for reasons unrelated to the Trump administration's recent decision to freeze funding to the organization. The Ebola outbreak in the Democratic Republic of the Congo and neighboring countries continues to grow. Experts are weighing in on whether to use the existing Ebola vaccine as cases increase. The World Health Organization says the vaccine should be administered only under a research protocol. Meanwhile, 2 Bundibugyo virus-specific vaccines are being prioritized for development. A new piece in The Atlantic takes a broader look at how U.S. funding cuts and political pressure are affecting global relationships with multilateral health bodies, and the long-term implications for global vaccine infrastructure. The Vaccines and Related Biologic Products Advisory Committee meets today to recommend which variant the fall COVID-19 vaccine should include. The committee is considering XFG, which differs from the guidance earlier this month recommending LP. However, the FDA's briefing document acknowledges that either variant could be appropriate, so we'll report back next time. 2 prominently circulating vaccine-skeptical papers have been formally retracted. Children's Health Defense is actively recruiting plaintiffs for a potential lawsuit over COVID-19 vaccine injuries in children. This comes on the heels of a new report stating that no pediatric deaths were definitively tied to COVID-19 vaccines. No new adverse event data have been published to spark this latest lawsuit, but we're flagging it because this type of lawsuit can generate a lot of hype and headlines. Insurance coverage for vaccines. AHIP issued a statement this week confirming that member plans will continue to cover ACIP-recommended vaccines without cost sharing through the end of 2027. With many state legislatures adjourning and the AAP v. Kennedy litigation slowly moving in the background, we want to hear from you. Which vaccine policy topic should we dig into next? Don't forget to like this video and share it with a friend. We'll catch you in the next one.